Well, as Gomer Pyle used to say, surprise, surprise, surprise. Well, not very much a surprise for most people out there, but our politicians failed us again. There was a recent congressional testimony. The commissioner of Social Security, who is about to leave his post, he's been there for a couple of years. He's done a great job, but he's about to leave. And he was asking for one last time for help from Congress to shore up Social Security, improve customer service. And what did the politicians do? Yes, they played politics and distractions. And we're going to talk about that today. If you're new to my channel, my name is Ed Weir. I ran the third business Social Security office in the country. This is also a live Q&A. I'm going to talk about that, and you have to vote on what type of cuts you want in the future from your Social Security check. And then I'm going to open it up to the floor. It looks like we've got a bunch of questions already. I'll answer any questions you have about all things Social Security, retirement, disability, survivor benefits, spouse benefits, the future of Social Security, all the rest of it. And we'll do that for about an hour and answer as many questions as I possibly can within that hour. Okay, so what are we talking about here? So, as of right now, the Congressional Budget Office, the Social Security trustees, pretty much everybody that's looked at the numbers say that we are going to get probably in 2034 a 21% cut. And maybe you'll be grandfathered in, or maybe you won't. It looks as though it's going to be across the board. So if you're receiving a Social Security check, expect in 2034 that to be cut by 21% as of right now. If some of the proposals that are out there, political proposals out there, if they get instituted, then it's going to be worse. We're talking about a 33% cut, and about 3 years earlier in 2031. So it's not this next presidential term, it's the one after that. So we're looking at about a 33% cut if some of the policies that are proposed actually pass. Or if we do the right thing, then we can shore up Social Security for us and our kids and our grandkids and all the rest of it. But we need to choose what we want to do. And one of the reasons that, let's say, we can't have nice things is that we keep falling for these tricks these politicians throw at us. They love to distract us for their own gain. And that's exactly what they did during this congressional testimony. They just started talking about a tad bit relevant, but essentially irrelevant things that are just distractions. And why can't we stop these cuts? Is because of these distractions. So let me go through and talk about each one of these. The politicians at this particular congressional committee said, well, we would like to give you some more money so you can, pick up your phones and adjudicate your claims and, help people with survivor benefits and disability and all that kind of stuff. But, we gave you money before. Sure, it wasn't enough to even cover, the increased cost year over year. But didn't you have this one guy in this one office in the country that did this one thing? Isn't some of your people, teleworking at home, and shouldn't they be in the office helping people? And it was just a distraction. I ran the third business Social Security office in the country, and this whole, excuse me, old Marine Corps sergeant here, this old BS about telework. Management can manage and make employees efficient, whether they're next to them or whether they're in the next office or whether they're in the next town. I can tell you by personal experience, every single day we assign appointments to people. So you're a claim specialist, you get 7 appointments, 8 appointments, 10 appointments today. And whether you're next to me or you're 5 miles down the street, you still have to fulfill those appointments. If you're on the phones, you have to log in at the phones at 9 o'clock and then log off 4 o'clock when the phones end. And in real time, I can tell whether you're right next to me or 5 miles down the street, whether you're answering those calls. So this whole thing about telework, and that's why this politician would say, well, we're not going to give you the money that actually you, the public out there, paid for. All those decades you paid for your FICA taxes, you paid for your retirement, and you paid for help getting your retirement and survivor benefits and disability. But the politicians are playing politics and these distractions, and they don't want to give the Social Security Administration that 1.2% that was supposed to be given to them so they can help you get your benefits. And that's why I came out of retirement to help you get your benefits, because Social Security, unfortunately, is not doing the right thing. They're not able to because they don't have the staffing. 50-year low in terms of staffing. All right. So efficiency, yes, every organization could be more efficient, but we're talking nickels and dimes, and the commissioner needs dollars. Um, Another distraction that I see all the time in my comments on YouTube is, well, if the trust fund wasn't stolen, or it wasn't given to this country, or whatever the case may be, that is all BS as well. Sorry. Just look at the Social Security trustees report. There's last year there's 2.7 trillion in there. It's in the bank. Full faith and credit the United States. And a lot of people say, well, there you go. Well, every country in the world, that is the safest investment in the world. Your 401k probably has treasury securities in there. So that money is being paid back. Last year it was 2.7 trillion. This year it's about 2.6, because $70 billion was paid out. So last year, 5 or 6% of your check came from the treasury, from the trust fund. So this whole distraction that politicians are playing, kind of the old Elmer Fudd type thing. You're saying, I'm going to get that rabbit, and that rabbit is the trust fund. But the trust fund is sitting right there. It's being used like it was supposed to. The problem is it wasn't enough because of the demographics, less kids paying into it in the future, and the fact that there's a cap. You and I, we pay FICA all year long. If you're making over $168,600 this year, you stop paying FICA, Social Security FICA. You pay Medicare, but you stop paying the Social Security FICA. So you and I pay FICA 365 days of the year. Someone like Warren Buffett or Elon Musk or whoever, they pay FICA for the first 17 seconds of January 1st, and they're done with FICA. That's why the trust fund is not the amount it should be, not because it was stolen or was given some other place. That's a distraction, and that's why we can't have nice things, is because we're distracted on that versus what we really need to do to have a serious conversations to save things. Same thing with illegals. Social Security money is not given to people that are here illegally. I can tell you 100%. In terms of Social Security, your state welfare program might give out benefits. Some other federal program might give out benefits to people that are here illegally. Whatever the case, we're not talking about that here. We're talking about Social Security benefits. If you come into the Social Security office, you have to be a U.S. citizen, or you have to have a legal status in the country. And I've taken hundreds of thousands of claims. Here's an example. This was kind of a tragic example, but I had personally, and people that worked at Social Security throughout the country, I'm sure, have had people that have come in that have been in this country for decades and decades and decades, served in the Vietnam War, and they come in 62, 65 in order to get their Social Security benefits that they paid into. We were not able to give them those benefits because they were not in the country legally. A lot of these were from Canada. They came over as young kids. Their family brought them over, but they didn't do their paperwork correctly. They always thought they were U.S. citizens, but they weren't. They never did things great. Even they went to the Vietnam War. They got a Bronze Star or a Silver Star in the Vietnam War, but they couldn't prove their legal status in the United States. For those people, they finally had to go to the INS and get it corrected and everything like that. Once they got their legal status, then they would come back and get their money. But in order to give out benefits from Social Security, when you type something, if you go into some application online and it's got a little red line there, it says, hey, you have to fill out this category to go to the next page. To submit your application online, you have to fill out, your date of birth. You have to fill out your phone number or something like that. And until you fill out that little red light, the highlighted area, you can't submit your application. Exactly the same thing with Social Security application. PCOM, PCAX, MCS, that's the internal program that Social Security uses. If that person is not a citizen, you have to put in the A number. You have to confirm it. You get the little green card, put it under a black light. If it looks suspicious, you have to do a save verification, talks to the INS, the United States, the new name, USCIS, to confirm that person is actually in the country legally. And then you can go ahead and go to the next page and adjudicate the claim. So this whole thing about Social Security money, retirement money or something going to illegals, again, that is a distraction that politicians use to change the subject so they can get what they want, kick the can down the road, and eventually get the cuts and eventually possibly privatize Social Security and give it to their buddies on Wall Street. And then they get out of Congress and they go work for their buddies on Wall Street and make tons of money and they're all happy and laughing all the way. International. Another thing out there why we can't stop these cuts is that people say, well, if we stop giving money to this country or that country or that country, okay, then that's a completely different issue. That's not the Social Security money. That's not Social Security Trust Fund. The trust fund is not given to one other country. The general revenue budget, that we're $36 trillion in debt, that obviously, if you want money to stop going to those countries, then okay, that's fine. But do not tie it to Social Security because when you do, you're falling for the distraction and you're essentially voting for a 33% cut in your benefits or a 21% cut in your benefits. So people that fall for these distractions are by default voting for a cut in their benefits. So definitions. I see this all the time. I say, you're entitled to this. This is an entitlement. This is a benefit. And people, again, distractions on the definition of words. An entitlement. It's not an entitlement. I earned it. Google entitlement in the dictionary. There's several different definitions of entitlement, and one of them is a legal thing where you're entitled to those benefits. You pay for it. If you fulfill certain criteria, you are eligible to receive those benefits, which is another legal term used in the insurance industry. So we're getting distracted by the definition of words, and the politicians are loving it. They're laughing all the way, and they're going to be laughing to the bank. And then there's the political game. Well, it's the Democrats' fault. It's the Republicans' fault. It's the conservatives' fault. It's the liberals' fault. Or whatever the case may be. It's everybody's fault. Is they didn't do this thing. We knew this was crunch time about 20 or 30 years ago. We've been kicking the can down the road. This next administration is essentially our last effort to stop these cuts. So if we keep falling for the politicians' distractions, their magic tricks about, hey, look over here, don't look over here, then you're essentially voting for a 21% cut or a 33% cut. And then that's kind of karma on you, but you're taking the rest of us down. So it's unfortunate, but we need to get serious about solutions. And I've talked in several videos about the possible solutions to avoid the cuts. But in order to do that, we need to have the political will, and we can't have the political will without having a serious conversation. Okay. All right, let's go ahead and go into your questions on all things Social Security, Medicare, and all the rest of it. All right, got lots of questions already. Let's see how many I can get to today. Brenda, I applied for disability before COVID. They said that they never got the documents. I filled them out again during COVID. They still claim they didn't get. So now I was denied. Well, they did get the documents because you were denied. But you're talking about some other type of documents, medical documents or something like that. So when you receive the letter that says you were denied, it'll have an appeal. What you do to appeal the decision, you have within 60 days. Usually they give you extra 5 days. So 65 days to appeal that decision. And it's an SSA 561. And you go ahead and fill that out and you return it and say, hey, you made a decision without sufficient evidence. I gave you the sufficient evidence for this doctor or that doctor, whatever the case may be, and you did not consider that. You can do what's called if you're past your 65 days, you can do a good cause statement. So on the 561, you just attach another piece of paper and say, the reason, I didn't do it when I was supposed to is because I just got the letter, or I've been sick, or traveling, or whatever the case may be. And you can have a good cause there and see if they'll accept it. When I used to get good causes all the time, I pretty much approved 99% of them. So, all right, let's see here. Skip, my wife and I are 64. I'm on disability with cancer. Oh my gosh. My wife was let go from her job of 30 years. We withdrew from a 400 401k to pay for bills. Now for 2025, my Medicare premium is 370 IRMAA. Now what? Okay. So IRMAA is the income related monthly adjustment amount. That's a higher Part B premium high wage earners pay because you took your money out of the 401k. So that unfortunately is probably going to be a capital gain. So unfortunately, Congress did not make an allocation, an exception for that. Um, but it doesn't hurt. But if that also includes your wife losing your job, because the IRMA, because you're married, it's based on earnings from 2 years ago. Okay. So if you're married, if you made over $206,000 2 years ago, then you're going to pay that extra Part B premium. But if you have what's called a life-changing event, which it looks as though you have, then there's an exception and they can roll back that extra premium. So I would definitely do that. It's a form, it's a SSA 44. So fill that out. It's a pretty easy form to fill out, return it to Social Security. And if they determine you fulfill the life-changing event criteria, then they will essentially pay you back, what you've already overpaid. And that premium is only good for 1 year, the extra premium, unless you cashed out a whole bunch of money the year after. So starting in January, so your December check, your December payment, which is for January Medicare, that will be the regular $185. They'll go back unless the extra money is for next year. But yeah, it's only good for 1 year. And then they reevaluate it again. If you're high income for another year, they add it on another year. But yeah, if you need help with all things Medicare, reach out to my partners at Chapter. They help with Medicare plans, Medicare supplements, Part D, Medicare Advantage, completely free. And we have until December 7th to find a plan. There's close to 2 million people that have had their Medicare plans canceled this year and millions more downgraded. So it's important if you've never checked your Medicare plan before, now's the time to do it. It's crazy. That's why I searched for a place that would help you all out. And they have a lot of people that are excellent that can help you all out for free. Oh, Kay Smith became a member, silver member. Awesome. You are too awesome. I appreciate it. Thank you very much. What is the maximum Social Security for early retirement? Well, the maximum Social Security for next year is $4,018. So take basically 30% of that. So the average check for 2025 is going to be 1976. So my husband turned 70 in January 2025. He started taking Social Security at 65. Will his Social Security increase take into effect? He has been working for the last 5 years. Um, yes, they check every single year. So essentially, you can get two benefit increases. COLA, which this year is terrible, 2.5%, but don't blame any politicians, or you can blame the politicians back in the 1970s. They're the ones that tied it to the consumer price index for younger workers. It should be switched to the consumer price index for elderly workers, but that's another thing we need to work on. We've got a lot of things to work on. That's why we need to start having serious conversations. So no more Elmer Fudd conversations. Okay, Brenda, let me get back to you. So every year, whether your husband or anybody out there is 70 years old or 80 years old or 100 years old, if you work and pay your FICA, then what happens, you file your taxes, you send it to your buddies at the IRS. The IRS sends them to Social Security, and Social Security looks at your earnings and says, is this one of the high 35 years? If it's one of your high 35 years, they kick out the low one, stick in the new one, recalculate, and your benefits increase. That doesn't take you know, that doesn't take effect immediately because you have to file your taxes and all that kind of stuff. So usually, there was a lot of people in October that have gotten onto my live Q&A and said, "Hey, I just got an extra money in October check," and I'm like, "Oh, did you work last year?" "Yeah, I worked." "Oh, there you go. Your benefit was increased." And what they do is, even if they finally do the calculation in October, and you're entitled to $10 more a month, let's say, then they give you $10 all the way back to January. So you get $100 plus $10, every month going forward. So that is 100% automatic. You don't have to do anything except file your taxes with your buddies at the IRS. Um, Am I using buddies? Anyway, let's see here. Oh, got that. Stop cost of living. Hmm, not sure. Let's see here. Are we getting a stimulus check? Yeah, I think there's someone out there that is in social media that is talking about a stimulus check or something. But it's we don't know until we know. And I can tell you, I'll show you exactly 100% certain, unequivocally, when you will get a stimulus check. When you see this image, when you see that, here we go. When you see that image on the news or special report where the president is standing in front of American flags and all that kind of good stuff, and because politicians love to pat themselves on their back when they give out extra money. So until you see that, then don't sit around and listen to social media about any stimulus money coming. Um, when you get it, you'll get it, and the president will get up there and tell you that last time I think Trump did it, President-elect Trump did it. He actually delayed it a bit so he could sign it, which nobody ever signs it, but he decided he wanted to put his name on it. So hopefully that the delay doesn't happen this time because he wants to sign it if one comes, but we're not exactly sure. Nobody knows. Um, let's see if they got paid through a payroll or paid taxes, which they did. Okay, I'm reading some other questions here. Um, yeah, if you don't pay into Social Security, but one of the things, a question about paying into Social Security and people that are not here legally paying into Social Security. One of those issues is, according to all the studies, people that are not in the country legally, they sometimes they get fake Social Security numbers, or they get a Social Security number, or from some other place, um, or they're here as a student, they get it temporarily as a student, and then they overstay their visa, um, and but they still pay into Social Security because the place they work at demands they pay through Social Security, but because they're not here legally, they're not entitled to those benefits if they become disabled or 62 years old or whatever the case may be. And so they will never get that money back. It's estimated that for Social Security alone, that equals about $27 billion worth of benefits that is paid into Social Security. That is essentially a donation because they will never get that money back. So that is helping the trust fund. All right. Can I still collect SSI? How much is penalty and will it affect following years? Okay. Misunderstanding about SSI. SSI is Supplemental Security Income. It's a welfare based program that the Social Security Administration administers. It's celebrating its 50th anniversary this year. So SSI is not Social Security income or anything like that. People often misunderstand it. SSI is a welfare based program, limited income, limited resources, and the max you can receive on SSI is this year is $943 a month. How to get health insurance if I retire before 65? If you retire before 65, unfortunately, you can't get Medicare. Um, the only thing is the Affordable Care Act, marketplace insurance, Obamacare, whatever you want to call it. So a lot of people that retire at 62, they have to wait 3 years in order to get the Medicare started, which starts at 65. If you are receiving disability, you can get Medicare. A lot of people miss that when they're on disability. If you're on disability, SSDI, Social Security Disability Insurance, not SSI, but if you're on SSDI, then after 2 years, 24 months, you're eligible for Medicare. And a lot of people don't realize that, and they're on disability, and they go ahead and get, private insurance that they're paying for. And, they contact me 3 or 4 years later and they say, yeah, I'm still, any way you can save me money on my, private insurance. And I'm like, you're on disability. Why are you paying private insurance? And they just don't realize that their Medicare, they moved or something like that, and never got the Medicare number. Maybe we should just cancel Medicare and let evolution and nature take its course. Okay, well, I'm sure you're fun at parties. All right. Another. It's my money and I want it. I agree. Republicans can pay back what they and Reagan stole. Again, we need to have a serious conversation, and that's not a serious conversation. The money, the trust fund is still there. If you don't believe it, then if you're getting a Social Security check this year, probably about 7 or 8%. Last year was about 5 or 6%. This year, about 7 or 8% of your Social Security check comes from the trust fund. So if you believe the trust fund is just a bunch of useless IOUs and it's not real money or it was stolen or given out to Mars or whatever the case may be, then please take that 7 or 8% of your check and donate it to me and or your local dog shelter. Give it to me and I'll give it to your local dog shelter. So but put your money where your mouth is. If you believe the trust fund is all fantasy, then give us that 7% back. I'm on disability and relocated, but never signed up for Medicare or Medicaid. All right, so yeah, if again for disability, you get Medicare after being on disability for 24 months. So if you're still within that 24 months, and sometimes a lot of people miss this is because of the staffing issues. We're at the lowest staffing in 50 years because of the staffing issue. um, it's taking forever to get approved for your disability. 6 months, 9 months, a year, 2 years, unfortunately. And say for instance you've been waiting 2 years and they finally approve your disability 2 years later. You get your first check and hopefully it's a big back pay. But if the judge determines you became disabled 2 years ago, you've already been on disability theoretically for 2 years. So you get your first check and you immediately get you immediately get Medicare. And a lot of people don't realize that, and then they do the wrong thing because they're kind of surprised that they now have Medicare. And so, yeah, so you need to definitely check, and but then you need to make the decision of what you want to do just having Medicare, because we're getting close to the Medicare season. So let me go through Medicare here a little bit and talk about original Medicare and the gaps. Original Medicare, I believe, is awesome. People love original Medicare. It's not perfect, obviously, but here's what we got. So original Medicare, Part A and Part B. Part A, both of these have gaps. They have gaps of coverage. If I was dictator for a day, I would eliminate all the gaps, and then you wouldn't need a Medicare supplement or a Medicare Advantage plan. But until I'm a dictator and can make all these changes by fiat, then we're kind of stuck with all the gaps. But regular viewers know that I would solve the problem of male pattern baldness before I fix this. So I'm sorry, I'm selfish like that. Anyway, Part A, there are gaps. This year, Part A deductible, if you go into the hospital, you have to pay the first $1,632. And that could be several times a year. Over that, over 61 days, you pay an extra $408 per day. It's $408 per day. And then there's another gap, skilled nursing facility. If you go into a skilled nursing facility, then it's $204 a day. This is all 2024 numbers. And then Part B, there is a gap, a Part D deductible of $240. And then you got co-insurance. So if you go into a doctor's office and he gives you a $100,000 Band-Aid and applies it, then you have to pay $20,000, 20%. And there's these things called excess charges that some doctors and hospitals, not many, but they can charge over Medicare rates, and you're liable for those excess charges. So the reason people get a Medicare supplement plan or a Medicare Advantage plan and the prescription drug plan and all that kind of stuff is because there are so many gaps of original Medicare. I wish there wasn't, but there is. And so that's, unless you've got a few $1,000,000 sitting around, under your mattress, then you really need to get something to cover those gaps, or you'll be in a world of hurt if you get sick or fall or something like that. So, and again, you can reach out to my partners at Medicare, at Chapter Medicare, and they can see what's available in your particular neck of the woods. All right, let's see what else we got here. Skip, zero cuts. Okay, Skip votes for zero cuts. All right, so I agree. So we need to come, so start the serious conversation. And I talked about this a couple of days ago about what could we do. Raise the FICA, eliminate the FICA cap, just to go ahead and decide to cut benefits or cut particular programs, spouse benefits, or cut, divorce spouse benefits, or there's other things that we could do to shore it up. So I won't go into all of those today because I've talked about it a few times, but we just need to have a serious conversation. All right, next question. Let's see here. Going to be 65. When do I sign up for Social Security, please? How many months before? So yeah, it doesn't matter what age you are in terms of however many, if you're 62, 65, 67, if you want to go ahead and start your Social Security benefits, about 2 or 3 months before is plenty of time. But if you're looking for any type of benefits, the number one thing is to go into ssa.gov, set up a My Social Security account, and check your earnings record, because your benefit amounts and your spouse's benefit amount and your surviving spouse benefits, your disability benefit, all those numbers depend on how much you paid into Social Security. And if Social Security has the incorrect numbers, you will get their incorrect benefit for the rest of your life, and everybody that's entitled to benefits on your record. So it's important that you check your earnings record. And we're coming up to Thanksgiving here. I'm going to be doing a 2 or 3 hour special live Q&A during Thanksgiving. So that way y'all can reach out to those people in your family that maybe you're not talking to anymore, and see if you can help them make sure they're getting all the benefits they're entitled to. I'm going to be doing that for a couple of 3 hours on Thanksgiving. It'll be 2 o'clock West Coast time, 5 o'clock East Coast time. Yeah, we about 2 or 3 months before is plenty. A constant other people in my doctor's appointments and then no surgeries. And okay, wait a sec. Can I collect Social Security benefits, still work? Almost 68 with healthcare coverage. Yes, if you have health insurance from work, because you always hear that if you turn 65, you have to sign up for Medicare. It's mandatory. Well, that's true, and it's not true. Just, you know, um, if you are turning 65 and you're about to make that decision whether to sign up for Medicare, then you can refuse it if you have health insurance from current work, yours or your spouse's. Your employer, the plan has 20 or more employees. And if those two things, current work, not a COBRA, not the Affordable Care Act, not a retirement, but it has to be through current work, yours or your spouse's, and your employer has to have 20 or more employees. If that's the case, you do not have to sign up for Medicare. You can sign up for Part A because, it's zero premium, but don't sign up for Part B because you're wasting your money. Next year it's going to be $185. There's a couple other things to think about it too. Sometimes your employer makes you sign up for, Medicare because they want to save money, health insurance company. Or if your health insurance and your particular company is bad, it's got a crazy deductible of $6,000 or $7,000, then okay, I have health insurance, but it's really terrible. So some people get Medicare because their health insurance is terrible. But you do not have to sign up for Medicare at 65 if those things apply to you. What do? Well, when you stop working at 67 or 70 or 80 or whatever the case may be, then you sign up for Medicare Part B. And you just have to get a couple of forms. One of them is the 40B and the 564. You take the 564 form down to your employer fills them out. They probably have copies of them down there. And your employer certifies that, yes, you've had health insurance since you turned 65. Don't penalize this person. And then you won't get penalty whatsoever. You'll just pay the regular Medicare Part B. But then again, same type of situation. As I just pointed out, Part A, Part B has a lot of gaps, so you need to find something to cover those gaps, either a Medicare supplement plan. If you've watched any of my videos, I always recommend a Medicare supplement plan. Those are the Plan F and N and G. Right now, I recommend Plan N because I'm cheap like that. The next would be a Plan G. It depends on your particular situation. Your particular situation, G might be better than an N. And then if you're not able to, if a Medicare supplement N or G is not in your budget, then that's when people get a Medicare Advantage plan. But with a Medicare Advantage plan, it's a lot more effort. You got prior authorizations and all this kind of stuff. And it looks like we're going to see tons of changes for Medicare going forward because Medicare also has a trust fund issue. And yeah, there's a lot of talk about making Medicare Advantage the default option, kind of a Medicare for all, but it's a Medicare Advantage, Medicare for all. Um, there's a lot of countries that have that private public type of health coverage, universal health care type stuff. But as they say, the devil's in the details. Medicare Advantage, private companies, but there needs to be regulation. That is, prior authorizations need to be addressed. The networks need to be addressed. And one day you have your doctor in hospital, and the next day you don't. So that issue needs to be addressed. Yeah, there's going to be a lot of changes, but I'm going to be here sitting around watching congressional testimony, um, and bringing it to your attention when it's out there. So there's that. So make sure you subscribe and like and all that kind of good stuff. Do you think the windfall elimination will pass this year? The windfall, it just passed the House of Representatives. Now it's going up to the Senate. Then it has to be signed by the president. Um, I certainly hope not, because 3% of the American public are now angry at me, but I don't think it's fair to the other 97%, including the 97% of police and teachers and firefighters that paid into the system their entire lives. There's a small 3% of the American public that paid into Social Security, but their main jobs did not pay into Social Security, and they're getting an extra benefit that wasn't intended for them. I talked about that in a few other places. It's based on how your benefits are calculated. Um, People that make $10,000 average earnings, they get about 32% a replacement rate. If you're making about $1,000 throughout your life on average per month, you get a 90% replacement rate. So 32% versus, you know, 90%. And those firefighters and police want the benefit that was intended for low income workers, which I don't think is fair for the rest of us. All right. Um, I will be 72 November 2025. Do I withdrawing my 401? How much do I take out that won't hurt Part B? Um, for this year, it's, if you're single, 103,000. For being married, if you're married, 206,000. What is it for next year? It is for next year. Let me find the numbers here. It's next year for 2025. It's 106,000, or if you're married, 212,000. But that's also, I'm not going to tell you to take out that much or anything like that, because that's also a IRS issue, and I never work for IRS, so I can't help you with tax type stuff. So, why do doctors and insurance companies not 100% secure health a priority? Yeah, that's, I guess, follow the money, right? I'm going to do a video probably this week on RFK, one of the proposals he has. So I'll talk about that possibly this week. Um, can I collect Social Security benefits and still work? Oh, okay. I already answered that one. Let's see. What are your views of starting Social Security early? Nobody can tell you. There's a bunch of videos out there that says you're stupid if you start your benefits at 62, you're stupid if you start them at 65, you're stupid if you wait till 70. And the people that make those videos are stupid, because it's all dependent on your particular situation. If they ask you a bunch of questions, then they can say, oh yeah, you should have, whatever. Do you need the money? Are you working? Are you going to be offset? Remember, if you take your benefits early, it's reduced $1 for every $2 you go over the annual earnings limit. Are other people in your family waiting for you to start benefits so they can start benefits on your record? How's your health? How's the longevity in your family? And there's a whole bunch of questions. So some people, it's best to go ahead and start at 62. Others, 60, full retirement age, or 70, or whatever the case may be. It really depends on your particular situation. So, all right, let's see. If I'm on SSDI and I get married, will I lose my benefits? No. If you're on SSDI, then you can get married, doesn't matter. You can get $1 million inheritance, it doesn't matter. For SSDI, Social Security Disability Insurance, it's disability based on your inability to work. So if you go back to work and make substantial earnings, then that affects your benefits. But being married or anything like that, no relevance whatsoever. If we're talking about SSI, Supplemental Security Income, which is the welfare-based program, then yes, that does matter, because if you're on welfare, SSI, and you're getting it based on low income and low resources, and let's say you married someone that makes $200,000 a year, you probably don't need those welfare benefits anymore. So, but you're on SS, but you asked about SSDI, and SSDI, no relevance whatsoever, unless there is an exception. That's why one of the reasons I do this channel is because there's exceptions, exceptions, exceptions. If you are a disabled adult child, that means you became disabled before the age of 22 and you're receiving benefits on a parent's record. If you get married to someone other than another disabled adult child, then your benefits will stop. Yes. I was born in 1969. I want to retire at 62. How much do you think I will receive in Social Security? Yeah, it really depends on how much you paid and the high 35 years of those benefits, of how much you paid into the system. So I can't answer that question because I don't know how much you paid over the last 35 years. So let's see. Yes, and someone mentioned that, yes, you can go into socialsecurity.com or ssa.gov, not com. Don't go to .com. ssa.gov, and then set up an account. I recommend everybody set up an online account, because when you do, you have to put all your information in there, your phone number and your email and stuff like that. And even if you never use it, set one up, because it makes it so much more difficult for someone else to go in there and pretend to be you somewhere in the world, and pretend to be you and set up an account and start causing you trouble. So go in there and set up an account, and it protects you. So, and when you go set up an account, then you can find out how much your benefits will be when you turn 62, 67, 70, or whatever the case may be. Can you get back pay after applying for survivor benefits? It depends on, are we talking about after full retirement age? Are we talking about back pay? And if you called Social Security 2 months ago and they dropped the ball, or you got sick and didn't make your appointment, then yes, you can get back pay. But it really depends on the particular situation. There is one situation that if you didn't know of an ex's passing, you could conceivably get benefits, back pay, and a lot of people don't know that. So if you know were married to someone for at least 10 years, and you lost touch with them, and you're entitled to benefits on their record, but you didn't know they passed away, it was like 2 years ago, you could conceivably get benefits. I'm going to have to make a video on that, because it gets kind of complicated, and a lot of Social Security employees miss that. So let me write that down before I forget. I've done over 800 videos, and there's always something else I have to make a video on, and I've got tons of videos I've got to make. So I'll be sticking around here for the foreseeable future. All right. I've been faxing these forms for my clients, and suddenly a Social Security office is saying they are not receiving. Um, yeah, that doesn't make sense, because if you fax it in, make sure you get a confirmation receipt. It goes into a system called WorkTrack. It's an internal Social Security paperless system, which I helped design, so I know it works, and unless they broke it since I've been there. Um, but it definitely goes into the system. If you get a confirmation receipt when you fax it, it went into the WorkTrack system. After that, as we used to say in the Marine Corps, and when you're out the rifle range, it's not the dope on your weapon, it's not the settings on the weapon, it's the dope behind the weapon is why you're not hitting the target. So in this case, it's not the dope on the work track. The work track works. It's just that it's the people, if they go in there and they take whatever documents you're sending and they send them to the wrong person, or put them in the wrong file, or whatever, or delete them for, I have no idea why would they do that. Yeah, they would have to have a supervisor approve a deletion of something at WorkTrack. But yeah, they received them. If you received a confirmation that it went through, then they received them. what they did after that, that's the issue. So I would speak. Sounds like you might be an authorized representative or something, or working for some type of covered employment for people on disability, and you're sending in probably pay stubs. And yeah, I have a feeling they're not doing the right thing in the local office. So I see ads for a card offering money for people on Medicare. Is it legit or a scam? Both. It is legit. Those actually do exist. I'm sorry for people on YouTube. I'm not showing the questions. For some reason, the questions that y'all are asking are not popping up. I'm not ignoring you, YouTube, but the questions are not showing up at all. And so I'm going to my other platform here, and I'm just answering questions. And so, but a lot of the same questions. So. All right, but the ad you see on these grocery cards, which you probably see when you're watching this channel, because I can't control what type of ads YouTube shows, but they are legit and they are a scam. So those Medicare cards, grocery cards, they're tied to Medicare Advantage plans, and they're over the counter, and they help with electricity and grocery and all this kind of stuff. They do exist. They're different throughout the country based on what type of Medicare Advantage you have. If you have a Medicare Advantage dual eligible, that means you have Medicare and Medicaid. They're usually better benefits for those types of plans. But the way they're advertised is very scammy. So if you see one pop up now and it says, "Hey, $3,000 grocery card, call us now," then that's probably that's probably scammy. Why? Because Medicare, the government has said, hey, you can't do that. You can't advertise something to the entire country that's only available in one small area. So if you got a grocery card in, let's say, Paris, Texas, where I went to high school, Paris, Texas, um, and it says $3,000, per year there, and free ice cream and unicorns or whatever, and then that health insurance company or whoever made that Facebook ad or YouTube ad, they advertise it to the whole country. You can't do that. That's a bait and switch. So you could supposedly, legally, you can only advertise those cards. So if that 3001 is in Paris, Texas, you can only advertise it in Paris, Texas. You can't advertise it in Tampa, Florida, or Portland, Oregon. So people that are doing that are suspicious, to say the least. So I probably wouldn't call that number, because if they're doing that kind of scammy type thing, they're probably going to be scammy through and through. So, but again, yes, they do exist. They do exist, but it really depends on your particular area and what type of Medicare Advantage plan you have. And again, you can reach out to my partners at Chapter, and they can check to see what's available in your particular area, in your particular situation, to avoid all of the scamminess out there. Let's see, other questions. The SSI website won't let me set up an account. What could be the problem? All kinds of different problem. Yeah, they've it sometimes is difficult, but it's difficult for a good reason, because Social Security has, they're trying to protect your identity and your information, so they make it a little bit difficult to set up an account, which is a good thing. We want that. But if you try and try and try, if you got the new ID Me, and they have you talk to this person, you have to show them your ID and the camera and all this kind of stuff. And the guy I talked to was like half asleep. But anyway, but he verifies you, and then you can get access. So they've got a pretty good, robust system to control access to your personal information, which is awesome. But on the flip side, it makes it very difficult for you to set up an account. So try your best. And if you're just unable to do it, then call the 800 number, and maybe they can have a trick to help you. If push comes to shove, if you go in there too many times, then you would have to go down to the local Social Security office and show them your ID, right there. So yeah, it's difficult for a reason. Was in the medical field. Social Security used to pay well. Now that I'm on it, can't find a doc who will take it. Social Security, or we were probably talking about Medicare. Yeah, so had a Medicare. That's one of the reasons why I always recommend a Medicare supplement plan versus a Medicare Advantage plan. With a Medicare supplement plan, the plan N and G, you can go to any doctor in the country that takes Medicare. and 95% of doctors, hospitals, and clinics take Medicare. But what you're talking about is probably the Medicare Advantage. There's a lot of doctors and hospitals, they're dropping Medicare Advantage all the time because they Medicare Advantage doesn't pay well. They pay late. They, all the prior authorizations, and so the doctor's office has to spend so much resources and staff calling up the hospital, calling up the insurance company. Can you approve this? Oh no, it's delayed. Have you done this? Did you tell your patient to, as we used to say in the Marine Corps, did you tell them to walk it off? It, another 5K and 3 mile run will solve all medical problems according to the Marine Corps. Um, but yeah, so some doctor's office say, hey, you know what, forget it. I'm not going to take Medicare Advantage anymore. Some hospitals are doing that as well. But if you have a Medicare supplement, then if that doctor or hospital takes Medicare, you don't even have to ask them if they take your brand of Medicare supplement. If they take Medicare, then they take the other one. They don't even, it doesn't matter. Because what happens if you go in there and you say, hey, anywhere in the country. So your network is America. You can go to any doctor or hospital in the country that takes Medicare, jump on a plane, go wherever. You take Medicare? Yeah, we take Medicare. Okay, you're accepting new patients? Yes, accepting new. Okay, jump on a plane, go anywhere in the country and show them your Medicare card. And you show them the other card, because what they do is if there's a, $10,000 bill, they send it to Medicare. Medicare pays their $8,000 and the Medicare system talks to your company and your company cuts the check for the other $2,000. No ifs, ands, or buts, no prior authorizations, none of that other garbage. So that's why people like the Medicare supplement, because they don't want to have some bureaucratic insurance, accountant make a decision that them and their doctor have already made. So I'm 70 and okay, let me since we're in crunch time for the annual enrollment period, which is going to be ending in 2 weeks. What I talked about, those 2,000 excuse me, the close to 2 million people that have had their Medicare Advantage plans canceled, they have a really good benefit now. If your Medicare Advantage has been canceled, you have the ability, it's called a guaranteed issue, to get a Medicare supplement plan. So usually it's difficult to get a Medicare supplement plan after you're 65. There's situations where you can, but if you've had your Medicare Advantage plan canceled, you have a guaranteed issue to get a Medicare supplement plan. Any Medicare supplement, either an F or a G, any company that's gives those in your particular area. So there's a lot of people out there that are very, very happy that they've been canceled because they're like, oh, good. Now I can, correct. I should have never signed up for Medicare Advantage. I should have done a Medicare supplement. But now I can't do it. Oh, wait, now I can do it because I've got this guaranteed issue. So make sure you keep that letter that you were denied or that your plan was canceled, and then reach out to someone that can help you and find a plan. Again, if you need help, reach out to Chapter and they can find you a Medicare supplement plan if it's in your budget. If it turns out that Medicare supplement is not in your, in your budget, then you have to find another Medicare Advantage plan because I guarantee there's going to be hundreds of thousands of people that have had their plans canceled that didn't get the letter, threw it away, whatever the case may be. And then January, when they go to the doctor, they're going to be shocked that the doctor says, okay, here's your bill for $2,000. And you're like, no, here's my plan. Here's my Medicare plan that I've been using for years. No, that was canceled December 31st. So there's going to be a lot of shocked people in January. So if you know anybody that has a Medicare Advantage or, grandfather, grandpa, and all that kind of stuff, make sure you reach out to them and say, hey, were you canceled or was your plan downgraded to such an extent you would rather cancel it yourself, which might be a very, very good idea. So yeah, and then that's one other reason I'm doing that live Q&A on Thanksgiving Day. So make sure you join for that. Someone asks, is Medicare supplement the same as Medigap? Yes, exactly the same. So Medigap, the gap part covers all the gaps of original Medicare. So Medicare supplement, Medigap, exactly the same thing. I'm 63 and on SSDI. I worry Advantage will not cover my costly medication for rheumatoid arthritis. Yeah, so if your particular Medicare Advantage plan, because the Part D, the prescription drug plans, come wrapped up in most Medicare Advantage plans. So when you get a Medicare Advantage plan, most of them come with a prescription drug plan. And if yours doesn't, for whatever reason, then maybe you need to switch to another Medicare Advantage plan that covers that particular medication and doesn't charge you an arm and a leg. And now is the time to do it till December 7th. But please do not wait for the last week for December 1st. That last week is going to be crazy. We're going to have the annual meeting of the Procrastinators Club that last week. It's going to be unbelievably crazy. So please get it done. Yeah, as soon as possible. Um, and re- you're on SSDI and you're 63 years old. When you turn 65, because people in most states, if they're under 65 years old, all they can get is a Medicare Advantage plan because of the state regulations. They can't get a Medicare supplement even if they wanted one, or sometimes it's like 5 times more expensive. But when you turn 65, you're in that golden window again that you can get a Medicare supplement without any health underwriting, so that you can't be denied for any pre-existing conditions. You can get a Medicare supplement plan and you don't have to pay any more than anybody else. So when you turn 65 and you're on disability, make sure you check. Um, can you get both Medicare and SSI? If all you have is SSI, no, but yes. Okay. So there's so many people missing pieces of the puzzle. When you're on SSI, that's the welfare-based benefit, you can get SSI and SSDI. Um, you can get SSI and retirement benefits, SSI and survivor benefits. Um, and but if all you have is SSI, then you're not entitled to Medicare. Possibly, some people are, some people aren't. Um, But if you're on SSI, you're also eligible for Medicaid from the state. And if you receive a certain level of Medicaid, because there are different levels of Medicaid, if you receive a certain level of Medicaid, then sometimes Medicaid will pay for your Medicare. So you can have SSI, SSDI, SSI, or excuse me, Medicaid, Medicare, and then you can get one of the Medicare Advantage dual eligible plans. If you have Medicaid, you can't get a Medicare supplement. The only thing you get is a Medicare Advantage, and if you're high level of Medicaid, then you'll get a Medicare Advantage dual eligible plan. Dual eligible because you have Medicare and Medicaid. Those are the ones that have all the great benefits, bells and whistles, and grocery cards and stuff like that. So, yeah, definitely reach out to my partners at Chapter, and they will help you out. And my partners at Chapter, they don't know Social Security. I told them, do not answer Social Security questions. I tell everybody on social media out there, do not answer Social Security questions if you did not read the 20,000 pages of Palms policy, if you've not taken hundreds of thousands of retirement survivor disability claims. Stop giving out information, because you're giving out erroneous information, incomplete information, and people are losing money because of it. So so please stop it. That's why I don't provide tax information. I didn't work for the IRS. I don't know taxes. I've been trying to cancel my subscription to the IRS for decades. All right. To clarify, I was just approved for Part B this month. I was on a private insurance with just Part A. Yeah. So if you're 65 and you don't want Part B, but if you're getting your Social Security benefits, you're automatically signed up for Part A and B, but you can refuse Part B. You cannot refuse Part A, but that's zero premium. One of the things to watch out for, if you're currently working and you're contributing to an HSA, a health savings account, then you have to stop contributing to that health savings account 6 months before your Part A starts. And Social Security employees fail to tell people about that, is because the reason it's not a Social Security issue, it's an IRS issue. You lose those extra, tax deductions from your HSA. So that's why Social Security, unfortunately, they don't really give out complete information about an HSA and all that kind of stuff, because that's more of a tax type thing. So, can't you change plans any time of the year with major health illness? No. Um, no. If for Medicare Advantage and stuff like that, if you move, then you have to change your plan. If you're canceled, then you can change your plan. But basically, October 15th to December 7th. There's another limited one, January, February, March. But yeah, there are certain situations, if you're getting a Medicare Advantage dual eligible, you can change. Um, but yeah, if you have some major health issue and you're just like, oh, I have to have, major surgery next month, so let me go ahead and find a plan that's better for that major surgery. No, no, you can't do it. No. With a Medicare supplement plan, the N and G, you can s- g- shop around for a cheaper plan all year long if you're healthy and depending on your state. So if you have a Medicare supplement plan G and the price is going up, you want to see if there's a cheaper one, you can switch to another company G plan because they're all the same in terms of the coverage, just the price. So you can go from one G to another G, but you might have to go through health underwriting. You can go from an N to a G to an N, and an expensive N to a cheaper N. But again, it's health underwriting. And F, sometimes if you're healthy, you can go from an F to a G or an N, depending on a lot of situations. So, and you can do that 365 days of the year. So, all right, we are over an hour, and I'm sorry, YouTube, that I didn't get to all of your questions there because I didn't see any of your questions. Unfortunately, not sure what kind of technical issues are going on here, but we'll get it fixed, and I'll reach out to the company and see what we got. But I will be back again tomorrow and cut and paste your questions. I'll be back again tomorrow and answer your questions then.